chasing a feeling.
Hello, everyone. Welcome to Feels Out Loud, brought to you by Becoming Together Therapy and Wellness. This is your host, Tara Martini, along with the fabulous Becky McNattin. We are glad to have you listening as we live and share stories of mental health.
Hello, listeners. It is so great to have you listening today. And Tara, we have two guests on our show and want to give a big welcome to both of them.
Yes.
Claar and Laurie Geddes are both integrative health providers, and we are super excited to have you two on the show to discuss how basic life components have a huge influence on our mental health. So thank you for being here.
Thank you for
So
having
exciting.
us.
I would love for you both to take a moment and introduce yourselves to our listeners and share a little bit about what makes you passionate about integrative wellness. Laurie, why don't you start?
Sure. I am a psychiatric nurse practitioner. I've been in practice for about 9 years.
Okay.
I work with individuals across the lifespan, although my preference is I love adolescents and young adults and transitioning into adulthood.
Okay.
I'm passionate about educating individuals about, the multifaceted approach to wellness. I do med management, but also talk about lifestyle interventions and just helping individuals become or get in the front seat of their healthcare.
Yeah.
That's a great way to put it. Mm-hmm. I like that.
When often we don't feel that way
Yep.
as individuals or patients in a kind of
Our
Western medical system.
Exactly. Yeah.
So fill us in about you, Melissa.
Yeah, so I'm also a board certified nurse practitioner in pediatrics. I am also have some expertise in integrative medicine and completed a 2-year fellowship as part of my training with the Academy of Integrative Health and Medicine, which is essentially where you take conventional mainstream medicine and you combine it with evidence-based holistic strategies.
Okay.
And I am also passionate about empowering individuals, primarily through education, equipping them with tools, and then sort of essentially guiding them along in their health journey, partnering with them so that they can really be at the forefront of that.
And maybe sharing some things that allow them really, as you said, driver's seat. I'm going to remember that for the rest of my week, which is really cool. Is different from sometimes approaches that we have. And so tell us about what lifestyle medicine is.
Lifestyle medicine is incorporating lifestyle interventions that we all do and creating patterns to improve health outcomes. So it aims to treat root causes of things. So let's just say we use nutrition or something to improve our health, the inflammatory response.
Yeah, exactly.
Okay.
Yeah. No, that's a great example.
And what would you say?
Yeah, I
When
agree.
we
I think
describe
Laurie
lifestyle
described
medicine.
it so well. It's also used to sort of both prevent and treat health conditions and to improve outcomes ultimately. At the root of lifestyle medicine, there's sort of 6 pillars. There is nutrition, so nourishing your body and your mind, physical activity, meaningful movement, sleep. We all know about sleep, stress management, which is a normal part of life. But really, how do we respond and relate to the stress is really what matters the most. Connectedness, and then finally, minimizing kind of risky or toxin exposures.
Okay. And I feel like so often in this sort of a Western system that we have, we don't think about those 6 pillars very often.
No, we don't. We just think medicate.
Yeah. It's like medication. Yeah. And so I'm laughing, even though it's not it's a serious topic, but I'm laughing because so often the things that are very foundational or structural to who we are as people are things we discard as unimportant or not to discuss, like it doesn't matter. And so we're going to get into all of this today. The 6 pillars. We're going to talk about sleep. We're going to talk about physical activity. Such an interesting topic. We're going to take a short commercial break right now, though, everyone. But stay tuned as we further explore lifestyle medicine. Thank you for listening to Feels Out Loud. We are going to be back in just a moment.
Find yourself. You gotta find your people. Express yourself.
Welcome back to Feels Out Loud, brought to you by Becoming Together Therapy and Wellness. I am Tara Martini, along with Becky McNattin. Let's dive right back into our discussion on lifestyle medicine.
I even love that it's called lifestyle medicine.
It just sounds fabulous. I just love it.
Sounds like something we don't do.
But yet we need.
Yeah, so Melissa and Laurie, there are different pillars that you mentioned in the last segment of lifestyle medicine, and I want us to go over them throughout the show today. You mentioned they focus on nutrition, sleep, stress management, social connection, really these essential aspects of human life that I don't know that we talk enough about because they're such an essential part of human life. Mm-hmm. And we have a ton of questions for you two around these topics, but I wanted to start with, how do you see lifestyle medicine and mental health intersecting?
It's a great question.
Yeah, huge intersection with mental health, as you kind of mentioned before, in the Western medicine culture that we currently function in. It is very much, there's a pill for every ill, is kind of how we treat things. And incorporating lifestyle strategies like physical activity, sleep hygiene, how we promote or teach people to get into a good routine, all of those things directly impact our mental health. They're shown to improve outcomes related to anxiety, related to depression. If you think about PTSD and symptoms that might be exacerbated with the fight and flight response. There are strategies that we can use, we can learn that empower individuals to use at specific times of exacerbation of symptoms. I think I read a research study that lifestyle strategies can reduce new onset symptoms of mental health by 70%. So,
wow.
So when we educate and teach people about these are preventative ways, these are things that you could incorporate in your life every single day. We all are faced with stressors, external stressors of a variety of types. And so these are 70%. I thought that was really, really important to know.
Yeah, and all too often, I would say something that's really interesting, right, is you go to a healthcare clinician office and ultimately you're often just told what to do. Mm-hmm. And I think lifestyle medicine really gives people the opportunity to exert some self-agency and to actually choose a different path to get back on a better, healthy path. So it is really empowering in a lot of different ways.
Yeah, and you two have me thinking about how in the mental health world, of course, we talk about anxiety, we talk about mood, specifically at the clinic Tara and I work at, lots of grief. And in my own experiences with grief, I don't feel like eating. I'm sleeping terribly. And therapists frequently are talking about really bringing it back to basic needs often of, when are you eating? Are you getting up and moving around? And so I can, although I said wow to the 70%, I can absolutely see how intricately and inextricably linked mental health and lifestyle medicine would be. What does this kind of approach to care include? What do people do?
I think this type of care, it's not like there's a roadmap per se. It's really about sitting down with somebody and getting to know them.
Okay.
And so starting to understand, what does your sleep look like? How are you nourishing your body?
Okay.
What are the patterns that you are engaging in on a day-to-day basis? And where is there a little bit of wiggle room? And to your point, Becky, when you've gone through something really difficult or are in the midst of doing something difficult, these lifestyle things, though they might seem really simple, are extremely difficult to execute. So having somebody to sort of support you in it so that even one little tiny change, which might be, I decide to take the stairs, this week instead of taking the elevator, that is still a win. And every sort of step forward or bit of progress is moving you in the right direction.
Well, and you say simple, but also can be so profound.
Totally.
Making those small changes. And I think, to Becky's point that you made earlier about at work, I think the practice does such a good job of also integrating kind of like this lifestyle practice of so much of the questions we ask our clients and work with are these lifestyle questions of, we'll talk to our clients about like, oh, their symptoms are increasing or escalating lately. One of my first questions is always like, well, how have you been sleeping?
Yeah.
And
right.
inevitably, it's
Totally.
always like, oh, not sleeping great. Or for a client who I know always works out, well, have you been going to the gym lately? And the answer is always going to be like, well, no.
Yeah.
It's like
And then you
because
get curious about it. Like,
yes, because there is such a connection between someone's mental health and these factors or the eating or the, all of these things where it's amazing to also see the light bulb moment when the client understands like, wow, those things do impact my mental health.
Right.
And sleep is the number one most important thing to mental health.
Yeah.
I mean, and I do a lot of education with adolescents in particular because they're overwhelmed with academic stressors, interpersonal stressors with friends, family stuff. There's a lot going on. Plus habits. They might stay up late and talk to their friends, be on technology. But sleep is when our brain kind of like regroups or the tank fills back up for the following day
Yeah.
of another day of, I say stress, but it's life.
Right.
It's constant
Stress.
external. It is stress.
Well,
It
just
is.
experiences that we face.
Yes.
Decisions.
Yep.
Yes.
And so I do a talk with a lot of the adolescents that I work with. I kind of just describe it as the tank talk. Like our brain is our tank, and it has neurotransmitters in it that get drained throughout the day based on these external stressors, academic stress, all those things. And sleep is when it fills back up. And so if we're not getting enough sleep, or if we have interrupted sleep, and actually, even if we don't get very good nutrition or don't have enough physical activity, those are all things that kind of boost up the brain.
And what would you say are the responses that you get from people when you talk about sleep?
Yeah.
Because you're smiling already. When sometimes I talk about sleep, they're like, no, I don't. Or I don't myself. I even get kind of frustrated with a medical provider when they're like, well, are you sleeping? I'm like, I want to flick you in the face right now.
Yeah.
I was going to say, says Becky, who literally gets like 4 hours of sleep.
I am Buddy the Elf, who likes to say I slept a full 45 minutes.
Yep.
So I'm chuckling about it, but what sort of responses do you get when you talk about sleep as so foundational?
Yeah, I mean, sometimes people are just like, I don't have time to sleep. I have things to do. I have homework to do.
Yep.
Like when I work with adolescents and adults, it is a lot, or young adults, it is a lot of, I have to stay up late to get my homework if I'm in sports after school, if I've done all this stuff. Like I can only get 4, 5, 6 hours of sleep. So there is some resistance initially because it is like, well, I've got all these other things to do. But it takes a little bit of time to educate people and give them that information. And even giving them small, kind of like Melissa was saying about, you don't have to go join CrossFit and do big strength training, routines.
Yeah.
You can go for a walk. You can spend time outside. Same thing is for sleep, is like do little increments, like improve a little bit each time, put your phone away 15 minutes earlier or something like that. And you will see as the pattern changes that the symptoms would improve over time.
And well, listen, nobody wants to be told what to do.
Right.
None of us.
Good point.
Yeah.
Yep.
So
Particularly a teenager.
Right.
Yes.
So that's, and developmentally appropriately so.
Yeah,
Yep.
I love that you say that.
I think that's one of the pieces, the nuance of exercising, pardon the pun, lifestyle medicine is you don't just tell people all the things that they should be doing with regard to sleep because number one, they don't want to hear it when you're just telling them what to do. It's directive. And number two, they may actually end up leaving your space feeling worse about themselves, which they absolutely did not need. So you might ask the question about sleep in a different way in which to elicit sort of some potential dialogue. And also kind of as you're kind of doing the give and take with an individual that you're working with, you might almost without asking directly have them ask the question themselves by probing. You know?
Yeah.
That's a really good point in terms of who's expert. You see yourself as a partner, as a lifestyle medicine provider. And when we can help people maybe see themselves, oh, this is an issue for me, or this is really pretty structurally important, that feels different. It feels different than having something be ascribed. And you said a few minutes ago something, Laurie, around preventative. This is a preventative approach. Certainly, we have some strong bias in this room around wellness and not an illness model, and that those are two really different ways of looking at things. You highlighted sleep. What would you both say are some key indicators in tracking or assessing overall wellness? My guess is sleep is one of them. But what should our listeners maybe tune into or focus on?
Oh, I love that question. So I always think the way to get at how somebody is maybe feeling in terms of their overall health and well-being is to ask them to reflect a little bit. You know, maybe ask yourself some questions. Something like, does the life that I'm living right now feel fulfilling? Am I able to show up as my best self, the version of myself I want to be?
Oh, wow. What a good question.
Do I feel connected, you know, to the people that matter to me, to myself, to my purpose? You know, these types of questions. Am I grounded? What's my body telling me? Is my body screaming at me? Is it nudging me? You know, is it trying to whisper, hey, that's not the right direction? Or, you know, maybe you need some more activity in your life, or, you know, you're not really eating so great because now your body's just craving carbs all the time, right? And so pausing and asking oneself these questions can really yield a lot of fruit and potentially be an impetus for, again, small, incremental, sustainable changes that add up to make a big difference.
That's so amazing. Yes, I love asking ourselves questions about what messages am I getting already? And also it feels like a very paralleled process to provider being a partner with who you're working with, and also that we wouldn't also tell our bodies from a very ascribed place, you're doing this now. That we're creating that dialogue with us and practicing curiosity on, what am I hearing? What am I learning? What would you say, Laurie?
I mean, I think, well, just to kind of go off that, because that was something I was thinking of, is when you are working with kids and teaching them about to get in tune with their body, like a lot of kids are very disconnected. They'll come in and say, well, I'm doing this, but I don't know how it's impacting me. Like, they don't make that connection. And so if I'm observing something in the office, I might help them get grounded and pay attention to how they're feeling. And then over time, help with some education on how, what nutrition you put in your body after you go and exercise. When you spend time with those friends, how do you feel? You know, and then making that connection so that they can think about it and then make changes in the moving forward.
That's such a good point.
Another thing that I sometimes will ask is, instead of just going into the educational spiel on whatever topic it might be, I may say, are you interested in learning a little bit about that? Would it be okay if I talk to you a little bit about why everybody is telling you screens aren't great at bedtime?
Yeah.
Do you want to know how it interferes with, you know, the production and release of melatonin, which is that hormone that sets your circadian rhythm, you know? And so I ask for permission oftentimes before going into the education, because it gets to the readiness factor. If somebody's not ready or interested, you don't, it's not probably the right time for them to focus on that particular area of lifestyle medicine.
Or asking them what they know already.
Yeah.
Like, kids love that. Like, what do you know about
That's a really good point.
That's a really good
Such a good point.
And so you mentioned sleep a couple minutes ago. How would somebody know, other than maybe if we could ask them, you know, hey, what do you know? What do you know about sleep? How might somebody know if their sleep isn't enough or restful enough? Because you mentioned if it's sort of episodic.
Yeah.
What would somebody see or be feeling from their bodies?
And if they don't have one of those fancy washes,
Yeah, that's true.
It is helpful.
The watch should be tells you.
Because the watch, apparently, I'll have clients be like, well, I got 45 minutes of whatever type. And I'm like, what if you don't have one of those?
I don't know.
Because I don't have one.
I don't have one either, and I don't know that I'd trust it anyway.
Right.
Agreed.
So educate us.
I
Okay,
like how
good.
Melissa's like, I don't know. They
Yeah.
maybe don't.
So educate us on how you can
Yeah.
do that without having a watch.
Specific questions I ask is it taking you longer than 30 minutes to fall asleep?
Okay.
If, a lot of times if you're anxious or you have ruminations or racing thoughts or still have kind of like an active brain, it might take you longer than 30 minutes to fall asleep. So that's one indicator.
Okay.
Are you waking up often through the night? And then how long is it taking you to fall back asleep once you do wake up? When you get up in the morning, do you feel rested?
Okay.
Are you kind of up and ready to go, or could you sleep a lot longer? Those are the main questions that I ask.
Okay.
Helpful to know. What
Yeah,
would you say, Melissa?
I agree. I think sort of picking apart the sleep per se, and then also sort of it can be useful to ask some medical questions, right? To sort of determine whether or not there might be some disorder related to sleep or sleep, comorbidity. Like, are you having a difficult time, feeling comfortable in your arms and legs? Are you feeling the urge to move them? That might be an indicator that you have low iron. Are you snoring at night? Is anyone, and typically people don't know they're snoring. It's somebody else in the household.
Yeah.
Or are you noticing that somebody's waking up and gasping for air, right? So sleep apnea. Are you sleepwalking? Are you sleep talking? There are a lot of different conditions in which you may need some management, some medical management in order to allow you to be more restful in your sleep, for instance. Zinc is important, and there is some association when zinc levels are lower, specifically in individuals impacted by ADHD, that they may not sleep as well, right? Magnesium as well. So there are a lot of different nutrients. Now, that doesn't mean you run and buy, zinc over the counter and start taking it so you can sleep, right? These are the nuances of kind of being able to work with an integrative practitioner who it's ripe for, uncovering these little treasures per se that could make a big difference.
Right, because, as you two are talking about it, or talking about this, it's making me think there's a big difference in taking a long time to fall asleep versus waking up a lot.
Right.
And as trained providers, someone waking up even after sleeping for 9 hours, Tara and I just recently had a discussion about this, and feeling exhausted, that's different than taking an hour to fall asleep at night too.
Right.
These are, from, as you referenced, dissecting sleep with someone who knows how to receive what those differences might mean. That's important, that we're not just kind of playing doctor with ourselves.
Right. Yeah, and even just asking somebody, like if they say, it takes me, anywhere from an hour to 3 hours to fall asleep, then I might say, that's so interesting. I bet you wish you were sleeping during those 1 to 3 hours.
Right.
Tell me what's going on in your mind or your body or both in that chunk of time. And then next thing you know, you understand what's going on with the person.
Can we go? Oh, sorry. No,
go ahead.
Can we go back to your previous answer and then go back to your answer you were just giving? Because they're both combined. So you started to comment about when you said the zinc and magnesium answer, and you said, but don't just go to grab an over the counter. And then we kind of stopped and went somewhere else with it. So then can you tell our audience, so then what do you do then if it's not go to the over counter? Because my first thought when you said that was like, okay, well, now I'm going to go to the store and get an over the counter zinc and magnesium.
And exactly. And that's why, again, I think it's so important that people are supported by somebody who maybe the expert in terms of the training and knowledge, and they've done all the work to sort of gain this information. But the person you're working with, the client or the patient, is the expert on themselves. And so again, this is a partnership type thing. So zinc, you can take too much zinc, and then guess what happens? You don't absorb copper, and then you can get copper deficiency, and that's not good either, right? You wouldn't know that. And magnesium, I mean, I wouldn't know that if I hadn't gone through training.
No.
So it's not,
I don't know that.
it's just recognizing where value comes from, and everybody brings some value to the table.
Yeah.
And magnesium, right? Like magnesium seems fairly benign, but it actually is renally excreted. So if you have any evidence of kidney issues, right, you probably don't want to be on a large dose of magnesium. Otherwise, you may get some electrolyte abnormalities and have other problems down the road. And so again, these are things that just because things are accessible over the counter doesn't mean it's necessarily safe. It very likely could be, but this is how you partner with somebody who's been trained.
Yeah. That makes total sense.
You got that, everybody out there. So, yep.
Tara
So
and I
make an
took it in.
appointment.
And so we see a lot on the mental health side, the impact of sleep. What do you all see as the mental health symptoms that might be present as a result of sleep challenges?
For sure, we see low energy, low motivation, fatigue, low mood, depressed mood, high anxiety are pretty common if there's a sleep disruption. It's very common in individuals with attention issues, ADHD, poor impulse control, kind of going back to one of the things we talk about if somebody's not getting enough sleep. Do they have a lot of energy in their physical body? Are they restless? Is that interfering with sleep? And then are you going to have increase in behavioral challenges the following day?
For sure.
Are you more agitated, irritable, struggling to get along with peers? Those types of things. Poor focus, poor concentration, struggling in school. All of those things are very common symptoms that we would see from somebody who's not getting adequate sleep.
And listen, the literature does show that, if you are getting a shorter sleep duration consistently, you are at a 55% increased likelihood of having sort of mood changes, whether it's anger, agitation, depression, anxiety, as Laurie said. When you think about the fact that the average person is supposed to sleep a third of their life, clearly things are happening, right?
Yes.
A third of your
Good
life
point.
is supposed to be sleeping. And so we have these little microglial cells that are in our brain, and this is a really interesting area of research that's ongoing. But we used to think they didn't really do anything, which I'm not really sure why we would think we had a part of us that didn't have a role, but it does clearly. And they're kind of like, I think of them like those little scrub daddy things. They're going around at night in your brain around your cerebral spinal fluid, and they're kind of cleaning up any of the waste or chemical byproducts that have happened throughout the day, right? So there is an active role. They are really important regulators of sleep homeostasis, or the balance of sleep. If you aren't sleeping well, the amygdala, right, that harm alarm in our brain, is not going to be well connected to the prefrontal cortex, so the front part of your brain that is responsible for, executive functioning, problem solving, emotional regulation, focus.
Sequencing.
Yeah, exactly, all those things. And so then there's a giant disconnect, and you're going to be operating out of a more reptilian type brain, more reactive. And so these are all things that we can see.
That makes so much sense, and one that maybe people wouldn't even. We know if there's a day that we didn't sleep well the night before, and the next day not feeling like ourselves, but also you have me thinking about what chronic sleep issues do over the course of time that may be subtle, that we're not even realizing the mental health impact, certainly the physical impact as well, in prolonged not getting enough sleep, where we're waking up every night for maybe even changing what our thought of normal is. And you and I have had many discussions about this, Tara.
Yes, we have.
That for someone, they're like, well, this is just how I sleep. Or I just wake up and I'm tired every day, and that's just what I do. That's me. That over the course of time, if this has been this way for months or years, how long also sleep would have to be a focus of healthcare, from maybe what you two are doing with patients in even noticing changes or difference. My guess is people, if they've had something chronic, they're not going to see a night of good
decline.
a night of good sleep or more rest-filled sleep, and they're like good to go.
Yep.
Would you have a circumstance that highlights that, where you've seen a sort of chronic issue over the course of time and how long it might take, because I have a feeling that some of our listeners, we're sort of a quick fix society. So we kind of want to do something and then have it addressed and have it done. Do you have a circumstance you worked with, or something we could tell listeners on here's how long it might take
to start feeling better?
Yeah.
I mean, I think, when it comes to starting to feel better, right, you have to create patterns, and it's not going to happen overnight. And sadly, the quick fix solution is not real.
Yeah, we say that in the mental health sector all the time.
Yeah.
And healing takes time.
Yeah. And healing is a process, right? It's like sort of living in the questions and trusting that things are going to unfold as they should. And, again, being open and curious. But I don't know that I have a specific amount of time, though I would say if you implement something like a new bedtime routine, or you really emphasize a couple elements out of sleep hygiene, I would say if your sleep improves, you should start to be feeling better after a few weeks to months.
Okay.
But you have to do this consistently.
It has to be a pattern.
Yeah.
I love that term.
Yeah.
And I think if you talk about it that way, to prepare them so that they're not expecting that things will improve in a night or two or even a week, and really show, even providing like a visual for them to show how sleep improves the neurotransmitters in the brain, the neurochemicals that way, whether it be physical activity, then they can do little steps at a time. You can encourage them, and then, but it does take probably 4 to 8 weeks, I would say.
Okay. So you mentioned physical activity just now, and I would love to transition to that. Share more about the role of physical activity in our lives and how this really impacts our health.
Yeah, well, physical activity releases endorphins in the brain. It's like a pleasure activity, so it increases dopamine. These are all neurotransmitters we target for energy, motivation, mood. And so being able to engage in physical activity is giving a boost neurochemically to the brain. Takes time, but
Although I would also say, something even as simple as, I'll give a personal example. This past weekend, I was particularly feeling a little more anxious, and I thought, you know what, I need to move my body. So I stopped what I was doing. I went outside and I walked along the river for an hour and a half. And next thing you know, I get back and I felt completely regulated. And so even though it takes time specifically to see the physicality changes, I think something as, some green exercise, being outdoors or connected with nature, there's a lot to learn from nature. There's a lot of metaphors that can kind of come to you, and all of a sudden you get clarity when you get out of the mind.
Yeah.
And you just, immerse yourself in sort of the healing properties of movement and nature.
Yeah.
Okay, let's say we have, maybe it's us or our clients. Like, love your example, but I'm not going to be going for an hour and a half walk. I don't have that stamina. But I love that you do.
Let's get real. It's not every day.
once in a while.
She was very anxious. Very anxious.
So let's say I have a client, or I'm just sitting here thinking like, okay, I'll give it 15 minutes. 15 minutes. Would 15 minutes be long enough to just go like around the block?
Absolutely.
Okay.
Oftentimes I even just say 5 minutes. Leave your house for 5 minutes, turn around, come back. That's a 10-minute walk.
Okay.
Do that for a couple days a week. And these are called like exercise prescriptions per se.
Okay.
And so
Love
that is
it.
something that we do, right, in integrative medicine. Again, we're not just telling somebody, I'm now going to spend time to elicit from you.
Yeah.
How do you like to move your body?
Right.
Is there a hobby that you enjoy? Maybe it's bicycling. Maybe it's skateboarding. Maybe it's climbing. I don't know. Maybe it's yoga with a friend. So little tiny things, you start small, and then maybe in a month you go to 10 minutes and then back. That's to 20 minutes.
Right.
And that seems like a long amount of time, but for some people that feels like a mountain.
If anytime we're starting a new pattern,
Right.
As you mentioned the word pattern, starting with something huge is going to feel not doable.
Right.
and becomes a barrier by itself. So I love that you highlight this, Sarah.
Well, yes.
Yeah.
Someone's like, I don't have an hour and a half. Anybody who knows me well knows that I'm all about a dance party.
Yes,
And
you are, girl.
I think part of what you're saying is you even engage with the people who you're working with around what physical activity resonates with you.
Right.
That we wouldn't necessarily do a prescription for physical activity around something that you're not even going to do.
Right.
Or that isn't maybe even could be a part of your life. You don't have the supplies or
the access to a safe neighborhood to walk in.
Right.
So what's an integratable kind of physical activity that often we use these things to rationalize in our heads? Well, I can't do that.
Right.
Because and so I love that you bring up, well, as you two even say, 5 minutes.
Mm-hmm. Right.
That's so great to hear in what aligns a lot with what Tara and I talk about on the show of think of what you're already doing in your life. Mm-hmm. What is your routine already? And is there a way to adapt that routine to fit in part of something else or to change it slightly because we're more apt to integrate changes that way?
Right.
Yeah.
And I think then there's more success of like, hey, I'm going to the grocery store, park at the back of the parking lot, right? Because then it's something I'm already doing. It's getting more steps in. And I think the chances of finding success are more likely for that than get a membership to a gym.
Yeah, right.
Or whatever, because...
And to be honest, I didn't set out to walk for an hour and a half. I just decided to get out. And next thing you know, an hour and a half passed. And so I think...
And that's different too then. See, I love that, where it's like, I'm just going to get outside and then...
And you start to see
It
what
just
you're
happens.
gaining from it.
I love
and then
that.
It continues to snowball into something really helpful and useful.
Yeah. So you two, tell us where you work.
Integrative Behavioral Health Services is a practice I went out on my own about a year and a half ago.
Okay.
And do you want to say where you?
I am at Wellnest, and so I'm a pediatric integrative medicine practice. The two of us are moving into a formal partnership here coming January
exciting.
1st. Yeah. So we will be renaming, and so stay tuned. Soma and Sage Integrative Health is going to be where you can get more services like what we offer.
Okay. So right now, if people wanted to look you two up, is there where they would find you at Wellnest?
integrativebehavioralhealth.com.
And integrativebehavioralhealth.com. And I'm guessing that we have listeners who have tons of questions about, just even what is maybe some more things about like a lifestyle approach. We didn't even get to things like food.
Yeah.
Which
Could be a whole hour.
This would be a part 2.
Which is also enormously foundational to what are we feeding ourselves during the day? Other pillars, spaces of connection, certainly stress management. So if people wanted to know more, would you say just like quickly, are there things that they could look up? Is there something they could reference?
Yeah, so there's a couple of resources. I'd suggest the American College of Lifestyle Medicine, Stanford Lifestyle Medicine. They both have very great resources. There is also a project called Speaking of Nutrition, because yes, it is a vast topic and so cool. And responsible for a lot of the issues that we have in our society. But Eat Lancet, it's for healthy eating for people and the planet. So that's a really great resource. And then Plant-Based Juniors is for children.
Okay.
Some really great plant-based recipes that can be used in strategies. And then the Academy of Pediatric Integrative Medicine are some places where people can check things out and learn more.
Wow. And articles, I'm assuming, maybe some.
Yes.
And you brought up a couple different times on the show, you two, that these are also ideas, concepts to do alongside someone who knows. So if you find yourself reading and you're interested to know more, do that. But the questions you have, don't answer on your own.
No.
that seek out a professional who does this, because there's going to be different answers based on you as a human being and an individual.
Absolutely.
So much to think about here. This has been really interesting. We're going to head to a commercial break right now, but when we come back, we will talk through all the questions that you all have been having about integrative wellness. Feels Out Loud will process your questions and thoughts in just a moment.
You gotta find the people. Express yourself.
We are back again with Feels Out Loud, and this part of the show is where we talk through questions from you all, our listeners. If you have a question related to mental wellness, sharing feelings, or topics for each week that you would like us to process through, please visit our website at becomingtogethermn.com and find the Feels Out Loud page to submit a question directly. Or email us at contact@becomingtogethermn.com. Of course, follow us on social media as well. We really do want to hear from you and what you are wondering about.
And thank you, listeners, for sending in your questions and your comments about lifestyle medicine. This has been a topic that lots of folks have things to say about, and we for sure need to have you two back after we have so many more things to explore. But one of our listeners says, I don't exercise. Love the call out. Listener, I am right there with you.
And I am as well.
I don't exercise, but I know I need to. What's a good way to start? And what
realistically,
would you say?
I would say you've already started, right? You've identified the issue, recognized it.
Well said.
As
Yes.
we think about this, right, there's the 6 stages of change, right? And pre-contemplation is when you kind of just don't even have any awareness of what's going on or that
Yes.
something needs to shift or change.
Good point.
So you've recognized it, and now you're starting to think about making a change. So you're kind of moving from pre-contemplation to contemplating. You're really starting to think about, okay, maybe I should be doing this. You may still be ambivalent. There may be parts of you that want to make a change and parts of you that don't. And so it's just kind of, again, thinking about what do you have to gain? And okay, so are those things you have to gain? Maybe it's greater mobility, so you can, depending on your age, hang out with your kids or grandchildren,
Sure.
or play pickleball. I don't know. It seems to be all the rage. And so that would be the first step, I would say. And then you move into preparation. Make a plan. Again, small change. Doesn't need to be big. Make a small plan, something that's achievable so you can feel good about it. And every time you move your body, you're going to release those endorphins. Those happy mood feeling hormones, and they are natural pain relievers. So if you have chronic pain, right, that will be beneficial to you. And then I would say 2 other pieces involve community. Doing it by yourself is a little trickier. Community makes it easier. You also have an accountability partner. And I'm always a big proponent of doing things outdoors whenever you can be in nature.
That's such a good point on we talk about accountability partners and people we can put in our lives often in the mental health sphere, who are people who will hold us accountable to the goals that we have. And it's one of the pillars of lifestyle medicine around connection we didn't get to today, but you can easily kind of get 2 things with one experience. And if you decided to go for a walk with somebody or you're going to sign up for a class with someone, have that person serve as an accountability partner for you, but also you may be talking while you're doing it, or you are more apt to stick to it when you have that external.
There's enjoyment there, and
Yes.
that's key.
Yeah, Laurie, would you say anything? Anything you'd add? No? Okay. Well, our other listener had a question that I think we answered, but I want to just name it again. They say, I've recently been trying a new routine to get better sleep. And how long might it take before I notice changes in myself from getting more rest? And what would you say to this listener?
Yeah, I mean, I think, we talked before that it could take a few weeks, 4, 8 weeks. I think what's really important to know is that routine is the most important. Figure out what works, implement strategies, continue with it over time. And then what we do know is that the more that you build into this routine, symptoms can continue to improve for months or even years. And the severity of the symptoms will depend on how quickly or how much longer it might take to achieve that.
Great point. Wow. That's the end of our show already for today. Thank you, everybody, for listening this morning. And join us next week as we talk all about dialectical behavioral therapy and its uses in mental health care. And in the week ahead, Be kind to yourself. Remember that connection fosters wellness. And everyone, your voice is one that the world around you needs to hear. Share yourselves, friends.
Some go, some will, some won't.